because but it just suddenly started not working. Sorry.
We've restarted, Chair.
Thank you. Apologies for that, everybody. So to pick up the conversation, I think John Boyd was wanting to come in.
Yeah, thanks. It was just a couple of observations in relation to the risks. The risks are usually summarised in the annual report and accounts, and that will be presented to the IJB. So I've seen elsewhere where there's a bit of discussion around the risks, and it can be a good opportunity timing-wise, given the content is within the front end of the annual report, is a good opportunity to discuss some of those risks at the board level without necessarily having to present the full corporate risk register. The only other comment we'd have, there's a few of the risks where, and it was interesting the comment made about the risk owner at the IJB. The IJB essentially doesn't employ staff directly, so it will have two officers, the chief officer and the chief finance officer. And interestingly, when you're looking at the risks, it would just be making sure they're actually attributable to the IJB and not necessarily health and social care partnership. And it's maybe worth I think about how do you get assurances from the partner bodies around those risks. So in the IJB's position, it's not that the risks are wrong in terms of the strategic focus for the IJB, but thinking about how you get that assurance through, it might actually be through the partner bodies around some of the operational work that they're doing. And that's the sort of thing that would, rather than if it was an organisation where you were actually delivering those services, you would get a head of or a chief officer would come up and provide assurances to the committee and discuss the risk. It might be just a nuance about the IJB relationship, about how do you get assurances from those partner bodies, because you can't really have a named individual that isn't part of your IJB structure, because it would essentially be a named individual from another organisation.
Yeah, so it could be. No, that's a fair point, John. And you ultimately could end up with, say, Fiona as chief officer, having some of them maybe in that kind of organisational structure. No, it's a good point. I just think if we're going to be targeted and focused on what the risks are and how they will be mitigated and controlled, etc., and responded against, I think if you don't have a risk owner, I just feel it's just going to sit in the ether and no one's going to take responsibility, is my view. But
thanks, both Johns, for that. John Boyd, just in terms of like other IJBs and how they deal with matters like that, do you think that this is something that needs to be apparent from the face of the risk register itself, or something that we have to make sure we're doing in the background, just so I'm really clear on what we need to be doing here? Thanks.
Is that in terms of escalating to the IJB board, or is that in terms of the named individuals?
So just in terms of the named individuals.
Yeah, so not a good practice would be you would have a named individual. I think for the case for the IJB, you really only have two individuals effectively to choose from. So you might just want that assurance about not only who the named individual is, but how you get assurance around those risks, and that might be then from the partner bodies in a lot of cases.
Thanks, John. Okay, Mike, is that just something that we can pick up again in our discussions in terms of, obviously we're looking at the risk register, we're going to see the examples in the interim before the next meeting, and then have another discussion at the next meeting?
Well, yeah, and it's something that we will probably maybe touch on as part of the discussion around the revised risk management policy and strategy as well, because I suppose there's the way that John's described, there are only Fiona and myself in terms of the IJB, but we do rely on the partner bodies and the staff that work for them, that form the Health and Social Care Partnership, to to be part of the risk management process, because that's how it works. So that should come out in the next document, and if it doesn't, then we'll have to make some changes.
Thanks, Mike. Is that you? I'm sorry, just a bit flustered because of the losing the connection at points. Is that everything concluded on the risk register in terms of?
Yeah, we just have to. Sorry, yes, we just have to note the. So Alex has to note the updates to the risk register. Yeah.
Yeah, and there wasn't any suggestion of adding anything to the risk register this time. Any new risks? I take it nobody had anything that they wanted to bring up today.
Nope.
Nope.
No one said anything at this point in time.
That's fine. Well, thanks. So basically, I think in that sense, we're just inviting members to report to note your recommendations.
Yeah.
Is everybody content to do that? Thanks. Okay, so I think that concludes that item. Thanks, Rebecca.
And moving on to item 7, which is the risk strategy and policy 2026. And again, that's with Mike Porteous.
Thank you. Okay, so the IJB's risk management policy and risk management strategy were last updated in 2022, and they're supposed to be updated every 3 years. So we're just a little bit out of date in terms of providing an update, but they are due to be updated. So hopefully everyone's had a chance to look at the revised documents. I did undertake some benchmarking and a good look around at what other IJBs are doing in terms of the risk management policy and risk management strategy, and what they were presenting. And I do feel that this revised document is more up to date in terms of its content and its presentation of a good risk management policy and strategy. So I just wanted to highlight the main differences between what we had before and what this document is providing. The main one, or one of the main ones, is we had 2 separate documents before. I've combined them into one now, and that's quite common across IJB land. And it just keeps everything in one place, and I think it flows a bit better from that point of view. So the structure and presentation of the document is, I think, a bit clearer from that perspective. It sets out the policy, so that's our approach to risk management as an organisation or as a body. How that policy is going to be implemented, so that's the strategy part of it. It highlights accountability in terms of roles and responsibilities. It's got sections on resourcing and training. It sets out how we monitor and measure performance, and it also provides information on how we will ensure that the risk management is communicated across the health and social care partnership. What it does, I suppose, in summary, is it provides a risk management framework that can be implemented across the partnership, across the IJB, and that's what I think it does. The one thing I think we probably do need to have further discussion on, and possibly not today, but possibly at the next Audit and Risk Committee, is around the risk matrix and the scoring that associated with that, because the risk matrix that's provided in the appendix and that is mentioned and referred to throughout the document has a slightly different in terms of its levels of scoring. So I would suggest that what we might do at the next Audit and Risk Committee is take a little bit of time to just go through that process of scoring the risks and land on the levels of interval, or the intervals that we want to assign to low, very low, medium, high, very high, critical. How many different intervals do we want, and how do we want to badge them up, just so that we're clear going forward what that means for us. But other than that, all I would say is that the document will be reviewed again in 3 years' time, and I'm happy to take any questions.
Thanks, Mike, for that report. And I think that sounds like a good idea to evaluate the risk matrix at the next meeting. I think that sounds like a important and useful. So that sounds good. John Blaseby, so you want to come in?
Yeah, I'm sure I'm never going to be invited back again. Yeah, I agree on what you're saying there, Mike. Elizabeth, I think it's good to go through that risk matrix. I think it's potentially quite confusing, isn't it? Difficult. But yeah, you go through that future meeting. I was actually going to ask Mike, but you kind of answered it. It would have been helpful to see a markup from the previous version because I didn't know what was changed. But I think you've explained it, but it wouldn't be very helpful to show that, given it sounds like you've merged two documents anyway, or more. So whether maybe that was not really a helpful kind of thing to do. I need to see a markup, I guess, because otherwise it's like what's changed. I guess I don't know what changed really from before. So that was kind of my overarching question. There's a couple of things. Otherwise, I think it looks very sensible. There's a couple of things that maybe just typos. I mean, just on, I might as well mention here. I mean, on 1 point, well, I think they're typos. In 1.5, it talks about appetite, tolerance of risk, and the second one, which is any high risk may be tolerable, providing the council is assured. I'm assuming it's not just a council, and that was just a typo, and that's probably a merged document typo. I'm guessing it's not just a council. And then I think I'd remove just on the next page, there's a little reference to Australia, New Zealand risk management standard. Can we get rid of that? I don't think sitting here in Scotland we should be referring to something down under, should we? I don't know if that was why that is in there, even why that's needed in terms of that reference right at the bottom, bookmark that. So just sorry, I mean, it's a very minor thing, but I wouldn't have that in there. Just shows you, Mike, I at least had a read of it. So
I appreciate that, John. And you're right. I noticed that one about the council myself. Too late, unfortunately, to do anything about it.
Yeah, and then of course we talked earlier about that link of governance in 5.1 about how you elevate these. We've had that conversation, elevating the risks and etc. to the IJB. So that's the bit I was referring to earlier. That's 5.1, which is fine. So yeah, I didn't really have any comments. I like to say it's just struggled to understand what was different, I guess. So I'm not really sure because I can't remember the previous one. But maybe I should have read it at some point. I can't remember. Maybe it's so. I'll stop there.
Thank you. I can send you the copy of the previous one if you really want.
I'll do a thorough comparison, Mike, for you.
I know. Don't. Well, you've had your chance. You can't come back again. Sorry.
Yeah, I'll stop there.
Thanks, John. Shameen, you wanted to come in?
Yeah, no, thank you. I think partly you've covered a bit of that, Jonathan, which is around, because we talked about the governance earlier, so there'll be specific risk reports, or you will continue to incorporate these within your finance reports as you're currently doing. So if there's, because it talks about that required to be brought to the IJB, so you'll just take a judgment of which risks you feel are the highest and include that in there, just to completely understand that if we've passed this, where that flow of information will be.
I think I try to highlight the risks as we go along in terms of the financial reports that I bring. I think when things change, that's when you really need to know if a risk has changed or there are new risks that appear, and then that's when the IJB should, I would think, would be most interested. But as I said, I'll bring an annual report on the business of the Audit and Risk Committee, which will include something around the risks and what's been going on in terms in that domain. And we'll look to see if we can bring a 6-monthly update to the IJB on the risks themselves. If that's what you're indicating would be a good idea, then we can certainly look to try and do that.
That'd be really helpful. Thank you.
Yeah, I think that sounds good as well. Thank you, Mike. Does anyone else have any comments on this policy? It all looks very clear and flows well and so on, and makes sense. So thank you for that, Mike. I think just inviting members to approve the revised risk management policy and strategy, subject to a couple of typos, which I'm sure will get resolved. So if everyone's happy, sounds great. Okay, thank you. That concludes that item. Thanks, Rebecca.
Thank you. So we're moving now back to item 3, which is the Internal Audit Plan 2026-27, and Duncan Steenbank is going to present.
Many thanks, and Elizabeth Welsh, you're away. I apologise to everybody else, but I apologise to you for being late, and thank you very much for moving the agenda items around to fit ridiculous diaries today. Very much appreciated. So this is the internal audit plan for 26-27, informing the Audit and Risk Committee of what our operational plan is due to be, and asking the Audit and Risk Committee to approve the audit plan for 26-27. This plan is prepared in accordance with global internal audit standards, as modified by the Public Sector Application Note. We take into account a range of factors, including the risk register, integration scheme, and the strategic plan in looking at putting together a plan. We also look at internal audits that we have completed over the last 5 or 6 years. Within the IJB itself. This is obviously the plan for the IJB, it's not a plan for the Health and Social Care Partnership, and both of the NHS Lothian and East Lothian Council have their own audit plans associated with that. You'll find the plan itself on Appendix A, the back of that plan paper. So 2 key auditable areas, risk management and performance management. As in previous years, we'll also be following up the work of previous audits that we've completed, and as part of that other audit, we do self-assessments against global internal audit standards. And I am also down as preparation for the annual governance statement. I'm letting the Audit and Risk Committee know, in respect of that, having your Chief Internal Auditor actually write the annual governance statement is not now recommended practice following a new amendment to the Local Code of Corporate Governance that was completed in May 2025. However, that's based on any kind of expectations that it would impair my independence in respect of that. I don't think I'm particularly impaired in respect of independence, but I'm making the Audit and Risk Committee aware of that, and in case they have any other conclusions in respect of that, I think I'm perfectly fine to produce the annual governance statement on that basis. Happy to take any questions on the internal audit plan.
Thanks, Duncan. John, do you want to come in?
Sorry. Thanks, Duncan. I guess, yeah, again, I'm a stand-in here, so apologise. I guess it would be, the overarching question is, why did we choose these 2? Risk management performance, you talk about, looked at the corporate risk register, looked at our strategic aims, and I guess it's sort of not listed here in terms of the linkage to them, and it doesn't have historical reports that we've done as well. And I apologise, I'm not part of this committee, so I'm not aware of what you've done before. So I guess my question was just, it's sort of hard to assess if these are the right ones, because I'm not quite sure that linkage of why we've chosen these in particular. It's quite a chunky piece of work, 6 weeks for the first one. So I guess that was my overarching, I don't know how to assess it without having the background and understanding why specific we've picked these. It's always a judgment call, obviously, but you tend to rotate through the audit universe, don't you, through year on year, pick ones that you've maybe had risk areas in terms of ones you've had before that you want to re-audit, or it's because of a particular aim or risk that you've identified, and rotate those through. And I guess that was my, I don't know how easy it is to answer that question. It's just why, how have we ended up with these ones?
I think I can probably find an easier way of doing this, Jonathan. So yes, absolutely. Yeah. And rather than go through the whole audit universe and give everybody that, effectively the audit universe work, and then looking at the risk assessments against items that we'd previously done. So we've obviously done quite a lot of financial audits over the last couple of years, as Mike will attest to, and he's probably sick of seeing my face in respect of that. Because that's where the big risks have been over the last couple of years. But equally, there's only so much benefit you get out of doing internal controls testing for continued years. So we went back to very much looking at the areas that we hadn't done over that piece as well. And effectively, there were 4 that came as potential to do this year. The two that we've got here, risk management and performance management. The other one was business continuity, which is actually interestingly challenging in relation to the IJB because, as John basically said, there are two officers. Neither of which actually work for the IJB, and business continuity arrangements are more getting better. Getting those assurances from the two partner organisations rather than necessarily the IJB in respect of that, which was the consideration, and absolutely all of these decisions were made in conjunction with both Mike and Fiona as the chief financial officer and the chief officer. We had a meeting to discuss those, and the other one was one that we had done probably about 5 years ago in relation to arrangements for transferring through to the community hospital, and that's probably now no longer really an appropriate IJB audit because the community hospital is now up and running and operating as is. So decided not to do those. Hopefully that answers the question kind of suitably in terms of the two that we've picked out of those four.
It does, yes. I mean, on performance management, just to sort of follow up, I guess I'm not entirely sure what that means, and I appreciate it may not be may not be scoped yet. I guess this has been done by BDO, or at least overseen by them, because that's the internal audit service provider for NHS. Do you know what that's going to be sort of covering roughly? I mean, any idea, or is that just too early to?
I won't go necessarily overly into details to allow the scoping to be taking place. Just in terms of who's doing that, there is one remaining principal auditor within the NHS framework, Russell, who we use to do most of the IJB work from the NHS, and he is still allocated as the person to do that. Obviously, if there are any changes in that, then we would hardly lean on BDO's other resources. It's an interesting arrangement for the IJBs in that I manage that work, albeit that we then use Russell's time to actually do the audit as such, and therefore there's involvement from BDO, and we agree the amount of time and when it's going to be spent and those elements with BDO, but I effectively manage the completion of the work, and it's done in the template that we use for the IJB rather than necessarily the BDO template that they use for NHS reporting. So it is done slightly differently. In terms of performance management, obviously there is there's a degree, or there's various degrees of performance management, and it is one of the IJB's functions to ensure that they're getting the performance management outcomes that they're expecting against the strategic plan that you've got in place and the directions that you're giving in respect of that. There's obviously overlaying functions within that because there are national indicators that get used quite a lot in that performance management framework. So we'll be looking at how that is being presented up through the IJB and into the board, and actually meeting the requirements of those outcomes is part of that particular audit. Again, hopefully that answers enough detail to your question. More than happy to get into more in depth with performance management if you're looking for it at the time, John.
No, that's fine. Thank you.
Thanks, John and Duncan. Duncan, I just had a couple of questions myself. First of all, I was just wondering, in terms of John's question about, he didn't know what's gone before, and obviously we do have changes in committee from time to time. In a year's time, when we're looking at the same thing, could we have a table with previous internal audits so that if there is a change in the committee, everybody is aware of what's gone before? I don't know how many years it'd be suitable to go back, but maybe 2 or 3. I don't know what you think of that, Duncan.
Yeah, no, I'm absolutely happy to do that, Elizabeth. Yeah, if we go back 3 years, I think that might make sense in terms of doing that. I'm happy to take views. We could go back 5 if it helped, but I think 3 is probably sensible in terms of giving that what we've done recently, because that's the bit where you wouldn't necessarily go back to those if you've done them in the recent past. As part of that consideration, you normally do try and do things on a 5-year cycle, but equally, if things are particularly risky and you've done them 4 years ago, you might consider doing them now if that was appropriate. So yeah, the last 3 years then takes those kind of topics up off the table, or at least allows people to understand why we're not picking them.
But also adding on maybe that, so it'd be helpful if there were any limited assurance reports during that time. They would be obviously showing those up, and so because obviously you'd go back, potentially go back over those areas, wouldn't you? So it's quite helpful for committee members. In fact, to be fair, yeah, even if I was a committee member, I'm pretty sure I wouldn't have remembered what you did last year or the year before. That's just everyone's too busy.
I would say you're crushing me, Jonathan, with the expectation that people don't remember what we do, but no, I
I'm sure they do. Understand. Sorry, Duncan. I'm sure they remember. I'm sure they.
Thanks, Duncan and John. The other question I had, Duncan, was when you were introducing you mentioned the new standards and the fact that it wasn't completely recommended anymore for yourself to prepare. Was it the annual governance statement? And I just wanted to check, what are other IGBs doing that on that, if you know, and does our external auditor have any thoughts on that? Thanks.
I could definitely answer. I posed the same question to the Mid-Lothian Audit and Risk Committee, and they were more than happy for me to continue producing the annual governance statement on that basis. Not only on that basis, as probably we've mentioned a few times in respect to the staffing that we have in respect of the IGB itself. If it's not me, then it might quite often fall to Mike to do, and it then becomes a question of whether that's probably more inappropriate than it is getting me to do it. So and the other one is otherwise it's again with the chief officer, and again unless you have somebody else that's very specifically governance for the IGB, it comes quite challenging to do it. So I can definitely say that I continue to be writing the annual governance statement for Mid-Lothian, because that's been agreed there, including, and they have an independent member who was a director at Audit Scotland prior to him fairly recently retiring. So and he was definitely in favour of me doing the annual governance statement there. So I'll lead that into John, then having his views from that perspective.
John Boyd, do you
disagree? No. So there are practical issues. I think the most important thing for me is about ownership of the government statement, rather than who's actually producing it and pulling the document together, to make sure there's an appropriate level of review and sign off, to be honest with you, and ultimately then for signing and inclusion within the accounts. The preparation of the governance statement, in practical terms, even when it's produced by a chief officer, they'll often lean into various individuals from across organisations in order to input into that, including internal audit. So it's never, completely prepared in isolation. I think the most important thing is that there's a review process in place to make sure that what's contained within the governance statement is complete and accurate and a fair reflection of the governance arrangements in place, and not just internal audit's view. It's actually a view of the IGB. I think you can achieve that by the proposed arrangements.
Thank you, I appreciate that. I confirm I'm very comfortable with that arrangement, but I just felt that it was appropriate that we had a discussion about it. Does anyone else have anything they want to ask? Nope, don't think so. Okay, so I'm content with that. So I think we're just is there anything, just trying to check the action sort of thrown by the change of order in the agenda. So just to check that members are happy to approve the internal audit plan for 26-27. Everybody happy with that? Yep. Thanks. I think we're content, Rebecca, with that item completed. Thanks.
Thank you. Moving to item 4, our internal audit recommendations follow-up, and Duncan Steinbank will present again.
Very much. Yes, this is a follow-up of our recommendations that we made in the internal audits for 24-25. So as a reminder, in terms of the internal audits that were completed within that year, we had the IGB Recovery Plan Monitoring internal audit that came to the September 2024 Audit and Risk Committee. We had the IGB Reserves Position paper that came in March 2025, and the IGB Governance Arrangements, which came in June 2025. So effectively, having followed up all of those audit reports and recommendations, and I find myself in a very bizarre situation of announcing that everybody else has done their actions apart from myself. So I can guarantee we did it thoroughly in terms of that. I'm desperately trying to find somebody else that hadn't done their actions, but no, the one remaining one is with me. That's in relation to completing a local code of corporate governance. I do have a template, but I want to make sure that it actually goes past everybody that needs to comment on it before it then will actually need to come to the IJB for approval at that point. And there's a need to revise the local code of corporate governance because of that amendment that's been produced for the Sit for Solace code of corporate governance across local authorities in May 2025. So we will be getting that out, and I'm hoping to get a draft out fairly early on in April, and hopefully get it agreed during April so that it can then come to the next appropriate IJB board for approval there. Sorry, and any questions on that?
Thanks, Duncan. I'm glad that matter is just in hand, and sounds like it's very close to being resolved. So thank you for that. Has anyone got any other questions? Don't think so. In that case, just invite members to note the report's recommendations. Thank you. That concludes that item. Thanks.
And moving to item 5, which is the East Lothian Integration Joint Board Annual Plan 2025-26. And I think we have John Boyd to present that report.
Thanks, Rebecca. I'm actually going to hand over to my colleague Ailey Montgomery, who is the Senior Auditor and leads on the annual audit for the East Lothian IJB.
Thanks, John. Yeah, so sorry, just to echo John, I appreciate I haven't met most of you. So just to introduce myself, I'm Ailey, as John said, the new Senior Auditor working on East Lothian IJB, just following David's upcoming retirement in a few days now. John remains as the engagement lead on the audit. We've completed a substantial amount of our audit planning work to date, and that work has informed the annual audit plan shared with you today. The plan is at page 17 of the pack, and the introduction confirms our independence in the audit and our compliance with ethical standards. The audit scope and responsibility section gives an overview of our planned work, which focuses on carrying out an audit of the financial statements and issuing our audit opinions on paragraph 5. In Exhibit 1, we highlight materiality levels for our 25-26 audit. This is a measure we use in our audits for considering any uncorrected misstatements in the annual accounts. We also set what is known as a reporting threshold, and this means that any uncorrected misstatements over that threshold will be notified to you as audit committee members via our annual audit report. We have one significant financial statement risk detailed at Exhibit 2, which is the management override of controls, and this is a presumed risk on all of our audits. We highlight the work we'll carry out to address this risk, which includes obtaining assurances from the auditors of East Lothian Council and NHS Lothian. We move on to the next section, which is on our wider scope and best value on page 25 of the pack. The Code of Audit Practice requires that public audit is planned and undertaken from a wider perspective and includes consideration of additional aspects or risks in 4 wider scope areas, including financial management and financial sustainability. We will report our conclusions on the effectiveness and appropriateness of the arrangements East Lothian IJB has in place for each of the wider scope areas in our annual audit report. In Exhibit 3, we've raised a wider code risk regarding financial sustainability, reflecting the forecasted budget gaps and financial challenges currently facing East Lothian IJB. As part of our final accounts work around this risk, we'll look to assess progress in developing the medium-term financial plans to incorporate funding and savings assumptions where possible. In the reporting arrangement section on page 28, we detail our audit timetable, and it is our plan to take our annual audit report to the September committee. Just to highlight, there has been a minor keying error in relation to the committee date for the issue of our letter of representation. this should read the 15th of September rather than the 1st. We'll update this accordingly and reissue our updated plan. Exhibit 5 outlines our audit fee for the 25-26 financial year, while the final section confirms our quality control system in place at Audit Scotland. I'm happy to take any questions you may have on our annual audit plan.
Thanks, Ailey. I don't have any particular questions at the moment. Does anyone have? Or John, you want to come in?
Well, just the obvious question, I guess, thanks, is just is there anything, it reads very sensibly, but is there anything which has changed in terms of risk assessment and approach this year, materiality, or is it broadly the same as last year?
No, our materiality levels remain are consistent with the prior year.
And in terms of risk assessment approach, is it basically the same in terms and at least, yeah, I don't know if you had issues before which had to be resolved last year, so therefore expect this to be relatively straightforward in terms of interaction with the sorry, go on.
Financial sustainability was raised last year. That's a reoccurring risk that we identify and then obviously look at final accounts. But in terms of our approach, it's not changed. I don't know if John, if you want to add anything or.
Yeah, just really to reassure that the overall risk assessment has remained consistent. There's not any significant changes in terms of sector requirements. I think, if anything, the financial sustainability risk has become increasingly challenging, particularly given the pressures on the partner bodies and resource availability, combined with the considerable pressures that the in terms of service demand. So it's essentially becoming more and more acute, that wider scope risk, but no significant change in terms of the financial statements audit itself.
Okay, so that's fine by me in terms of the approach and etc. I guess for Mike, which I don't think is a question for this necessarily for this committee, is in question to the fee. I don't think that's more of an operational matter, I think. So I guess I don't know if what percentage increase, if any, that has gone up from last year, and whether you are satisfied with that or not. I don't think, or are you asking for approval of that? I think that's an operational matter, like I say, but that's in the paper. I guess that's a question for you, Mike.
Just go in. So yeah, it's gone up slightly from last year, but not materially. And we've paid the first instalment, so we've accepted the fee.
Right, so that's the agreed fee. Okay.
Thanks, Mike. Does anyone else have any questions? Shameen?
It was just to follow up around the financial sustainability, and I kind of read that alongside your other Audit Scotland reports that you've carried out on kind of IJBs across Scotland. And I just wondered how, I know this is be specific for East Lothian IJB, but how much you will kind of lean in on that national picture for East Lothian IJB or not.
Yeah, so essentially they both feed themselves. So the national report is based on the outputs from the annual audit, as well as a central kind of data gathering exercise. But likewise, when we're undertaking the audit work, we'll obviously refer to the national report. Just before Christmas, I was actually involved in a roundtable discussion with various representatives from IJBs around, and it was actually a very helpful insight in terms of the financial position and the challenges they face. It was essentially discussing the national report, but looking at some of the unique challenges that the IJBs face, and I think a lot of our reporting has been on the essentially sort of waiting times or securing essentially beds and the flow through of patients and patients' journeys, but they were actually highlighting some of the actual unique pressures. For example, the cost of weight loss drugs, which in the longer term could have significant health benefits and financial benefits for the health sector if symptomatic conditions aren't of individuals being overweight don't then put pressure on the health sector, but the cost of those drugs is significant to health boards, so it's almost like an upfront cost, if you like, or an upfront investment. And the challenge that then creates, where you're in a sector where there isn't that upfront investment, there is no money to invest to save, if you like. So it's how our IGB's working, you know, in order to do that with the partner bodies. So there's good discussions that took place that was just before Christmas. So in terms of your point, yeah, we lean into the national picture, but also then considering what the local factor is. What you tend to find, and this is something just when comparing against IGBs, is the integration schemes vary from IGB to IGB, as do the funding models. And that is something we see play out. So some IGBs will have essentially an equal split where if one of the partners has overspent in delivery of their key functions, the ultimate responsibility for that overspend will rest with the partner. So if it's health related services, it would be the health board ultimately would under the funding arrangement be responsible for that. That's not the case across all IGBs. So although we talk about IGBs as a whole, and there are obviously commonality, there are certain aspects of the integration schemes that vary. So you just need to take those in mind as well.
I know I'm just always cognizant that when we're comparing IJBs with each other, that some areas are very different rurality and population growth, and the East having that bigger challenge than anywhere else in Scotland, and always kind of mindful of these audit reports are really important for us to engage with the public of our challenges and risks of how we're able to communicate that, but they're always helpful.
Thank you. John or Ailey, I had another question, just in terms of Exhibit 2, in talking about significant risk of material misstatement, and also mentioning particularly the opportunity and incentive for fraud. I just wanted to check, as a committee, how do you see our role in this? Because obviously it's difficult the way that IGB funding, where the funding works with partner organisations, in terms of what you're expecting of us. Just if you could maybe just explain, and if there's any learnings from other IGBs. Thanks.
So the committee will have a specific responsibility for oversight of fraud and fraud arrangements, to mitigate and prevent against fraud. And actually, as part of our planning procedures, that's one of the aspects that we will look at in terms of what your governance arrangements. As you said, in terms of the IGB's actual financial transactions that appear in the annual accounts, they're relatively straightforward. But what we do is engage with the auditors of the health board and the council for assurances that there aren't any indications of fraudulent transactions at the partner bodies that could have a material impact on your financial statements. So essentially, there isn't a fraud that then flows through. But at the very high level, the IGB's actual financial transactions are relatively straightforward, where essentially you're getting funding from partner bodies and you fund partner bodies. At the very high level, that really is the IGB's transactions. The actual delegated and spend takes place at the partner bodies, partner bodies themselves. In terms of different aspects of how you get assurance over that, some can come through. I mean, obviously there's that process. We have seen where finance functions will often get assurances from the relevant directors of finance, essentially confirming balances and transactions at year end, and the assurance that there's no there's no indication of fraud. The other aspect is your ongoing performance monitoring. So you're essentially funding the delivery of services. So when you see those services being delivered and you've got that through the performance monitoring, it gives you reassurance then that what essentially you're spending your money on, you're in receipt of those services. And where I've also seen it is where there's specific reports that are undertaken usually by internal audit at the partner bodies that might have relevance to the IJB, that those would also be shared and giving you that additional assurance. But there can be some challenges around sort of data sharing and things like that when it relates to those bodies. But that's something I've seen come out as well, just to give that additional assurance.
Thanks, John. I see Duncan's got his hands up.
I thought I'd kind of come in on this question in particular because the question of fraud in IJBs is quite it's one of those where within the transactions and actually the operation of the IJB itself, the likelihood of anybody being able to commit a fraud is extremely low. Completely, because there are no financial transactions that really actually go through the IJB, because all of those are done on partner systems instead, in respect of that. And actually the only fraud I can imagine somebody trying to commit in relation to the IJB would be putting on a direction that directly benefited themselves as one of the board members. But I think that would both be incredibly transparent and as you're all asked to publish your register of interests, it would be a highly public way of going about things, and I think it would be entirely obvious. So not something that I would ever expect to happen in that respect. And it is one of the reasons why we bring partner internal audit reports to this particular board in case there's anything of interest, and particularly if there would be anything around fraud, to make sure that you're aware of what's going on in the partner organisations. I know many of you are already, so and I know Elizabeth, you'll say that you've seen a lot of the audit reports coming from the NHS Lothian anyway when it comes, but it's part of fulfilling that function. So I think our risks are fairly low within those, and in both partner organisations we have appropriate processes in place to manage that risk of fraud, and there's appropriate reporting within those organisations of those processes as well. Sorry, I'll stop talking now on that subject.
Thanks, Duncan. That's really helpful. Thank you. John, do you want to come in?
Yeah, that's interesting. Yeah, isn't it? Because when you think of I guess it doesn't apply to us. The Economic Crime Corporate Transparency Act. I think that's and which is now live, since last year, and it brings in this corporate responsibility in terms of preventing fraud. But I guess in terms of what you just described it, Duncan, I guess I don't know, that must apply to us, I guess, doesn't it? It's the IJB. I don't know, given the framework of the IJB, I'm not sure if that law applies or not, and whether that makes any difference in terms of how the audits are done. I'm not sure. Yeah, it seems a complicated area to me, and it seems odd given the framework.
Yes, the law does apply to the IJB, as it does to any kind of incorporated body, as such. But as said, our risks for the IJB itself are incredibly small. I can talk very competently to what's happening across East Lothian Council in respect of that particular law, in that we have recently completed a full fraud risk assessment across the council in total, which is part of the requirements in respect of that, and where there are controls that can be improved, they are in the process of improving those. So there's been one or two areas that have been identified where that can assist. So
yeah, well, unsurprisingly, NHS Lothian are conducting the same. Well, they are conducting that fraud assessment. I'm not sure it's actually been completed, but it's good that you say that the council actually has done that. It's like you say, I think a key part of that are the requirements of the Act. So that probably covers us to a degree.
I was going to say I was aware that the NHS were doing the same thing. I'm not quite as aware of exactly whether it's finished. I think it's still in progress.
It should be done by. Well, hoping it's done by our next Audit and Risk Committee meeting, which is coming up in a few weeks. So, anyway.
So I think that gives a lot of assurance that both partners are taking it very seriously and have the right processes in place.
No, I think that's a fair comment. Yeah, thank you.
Thanks both. Yeah, that does sound reassuring. So thanks to Ailey and John for presenting the audit plan. Did anyone have any additional questions? Don't think so. In that case, I think we're invited to note the report. Thank you. Thanks, Rebecca. I think that concludes that item.
It does, thank you, and also concludes the business for today's meeting. So if I could just ask everybody to mute their microphones, and we'll ask Alana to stop the recording.